to Health in America. On today's show, our guests will be discussing the relationship between identified critical health issues and health disparities. First, we have Ms. Alana Thornton, a representative of the Department of Human and Health Services, and she's going to discuss their action plan to reduce racial and ethnic disparities. Thank you for coming.
Thank you for having me. We at the Department of Health and Human Services have identified 5 goals in an action plan to reduce health disparities. The first goal in the plan of action to reduce racial and ethnic health disparities is to transform healthcare by ensuring the uninsured and making coverage more secure for those who already have it. Minorities have lower rates of health insurance than the national average. The first goal also includes improvements in the overall quality of care for all races and ethnicities. The second goal is to strengthen the nation's health and human services infrastructure and workforce. To achieve this goal, the HHS wants to increase the ability of all health professions and the healthcare system to identify and address racial and ethnic health disparities. The HHS will address the critical shortage of racial and ethnic minorities in medical fields such as primary care physicians, nurses, behavioral health providers, long-term care workers, and community health workers by preparing students for these professions. Most importantly, the HHS would like to improve language access, advanced translation services, promote the use of community health workers, and increase the diversity of the workers. The third goal of the action plan is to advance the health, safety, and well-being of the American people. To achieve this goal, the HHS plans to reduce disparities in population health by increasing the availability and effectiveness of community-based programs and policies. The fourth goal of the plan of action is to advance scientific knowledge and innovation to do this. There will be an increase in the availability and the quality of data collected and reported on racial and ethnic minority populations so that progress can be documented. The last and final step of the plan of action is to increase the efficiency, transparency, and accountability of HHS programs. To do this, grant admission for health disparity funding will be streamlined. We will monitor and evaluate implementation of the HHS Disparities Action Plan, and there will be goal-level monitoring and surveillance.
Great information, and I look forward to how the department will do with this initiative. Next, we have Ms. Tiara, who works with HSC. She's specifically here to discuss the relationship between the constructs of cultural competency and humility to health disparities. Welcome.
Thank you for having me. Well, cultural competence has emerged as an important issue in healthcare. Humility is best defined as a set of similar behaviors, attitudes, and policies that come together in a system to work effectively in a cross-cultural situations.
Now let's break this all the way down out for our audience members. How does cultural competence and cultural humility relate back to health disparities?
Okay. Cultural competence has gained attention as improve quality and eliminate racial ethnic disparities in healthcare. Health disparities deal with the difference in the health status of different groups of people. Examples are like health disparities towards this goal to include providing relevant training on cultural competence and cross-cultural issues to help professionals and creating policies that reduce administrative and linguistic barriers to patient care.
Wow, did any of you in the audience know that information today? I sure didn't. Well, we appreciate you coming on today and discussing that with us. Thank you. Ms. Tiffany Johnson, who works in the Obama administration, she's coming here to talk about the Affordable Care Act, which is one of Obama's key initiatives.
The purpose of the ACA is to make insurance more affordable for those who have little or no coverage. The ACA is also intended to reduce health disparities. Disparities occur in the quality of care received even when income, health insurance, and access to care are taken into account. Despite the efforts to address these issues, racial and ethnic disparities in healthcare in the United States still continue to exist. Patients from racial and ethnic minorities often have it far worse than their white counterparts on a range of health indicators as far as life expectancy, infant mortality, presence of chronic diseases, and insurance coverage. The ACA includes both general and explicit provisions that narrow down these gaps. To specifically address disparities, the ACA requires tracking every patient's race, ethnicity, and language preferences for federally funded health programs and public health programs. Tracking every person's race, ethnicity, and language preferences is necessary to identify and eliminate health disparities in care and improve the quality of care for all patients.
Thank you, Miss Tiffany, so much for coming today. Next, we have Miss Yvenka Quettant to discuss the Iron Triangle. What actually is access, cost, and quality in layman's terms?
When access, cost, and quality are out of balance, they affect consumers, healthcare providers, and the whole healthcare system as a whole. When the needs of the consumers are met, they provide them with access to healthcare, reasonable costs through insurance coverage, and high quality of healthcare are available through a choice of variety of doctors in a timely manner. However, that is not always the case. In healthcare, particularly speaking of access, cost, and quality, there are many health disparities. Health disparities are not just based on race, ethnic, and cultural differences. Other characteristics include age, lifestyle, sexual orientation, socioeconomic status, and many more.
Well, how would you say, Ms. Quettant, access, cost, and quality relate back to health disparities?
Well, racial and ethnic disparities in healthcare are significant factors that create many ethical dilemmas in the healthcare sector. Healthcare that is inaccessible or poor quality care can create many issues between the consumer and physician. Most people in low socioeconomic places lack knowledge, proper care, and barely have access to clinics, educational classes, and healthcare settings that are found in other areas.
I see the relation, but I need something more tangible. Could you give us an example?
Okay, well, for example, infant mortality for African American babies remain 2.5 times higher than for Caucasian babies. This may be due to lack of resources to receive care or lack of education and knowledge on how to prevent this situation. Health equity should be the universal goal to obtain, looking to be achieved in the healthcare sector in order to attain the highest level of health for everyone, regardless of color, gender, disability status, or any other characteristics.
Now we have a legal specialist, Briana Warren, who's going to talk about the recent Zubik versus Burwell case.
The Zubik versus Burwell's case is an ongoing case that is before the United States Supreme Court on whether religious institutions other than churches should be exempt from the contraceptive mandate, which is a regulation adopted by the U.S. Department of Health and Human Services, also known as the HHS, under the Affordable Care Act that requires employers to cover the cost of certain contraceptives for their female employees. The case centers on the exemption to the Affordable Care Act's legal requirement that employers must cover contraceptive costs without charging copays. Employers can opt out, but to do so, they must complete a 2-page form explaining why. The ability to plan if and when to have children is fundamental to the health of women and critical to the equal functioning of women in society. This case relates to health disparities because racial, ethnic, and socioeconomic disparities in rates of unintended pregnancies, abortion, and also unintended births exist at a high rate in the U.S. These disparities can contribute to the cycle of disadvantage experienced by specific demographic groups when women are unable to control their fertility as desired. Upon research, I found that there were 3 factors which contribute to disparities in family planning outcomes. 1, patient preferences and behavior. 2, healthcare system factors. And 3, provider-related factors. Through addressing barriers to access to family planning services, including abortion and contraception, and working to ensure that all women receive patient-centered reproductive health care. Healthcare providers and policymakers can substantially improve the ability of women from all racial, ethnic, and socioeconomic backgrounds to make informed decisions about their fertility. Thank you.
I know it's been a bit boring with all the constant talking. So now we have people who brought in the clip because they couldn't make it into the station today. They are Whitney Dickens and Khanijah Kelly, and they're going to be talking about the ethical Barrett decision model.
Hi, I'm Khanijah Kelly.
And I am Whitney Dickens.
And we're going to talk about the Barrett decision model. Making an ethical decision takes time as well as careful observation. The Barrett decision model is a decision-making process that has 5 steps that build on top of each other to help solve many issues when dealing with health disparities. Whitney's going to talk about the 5 steps.
Step 1, be attentive. Step 2, be intelligent. Step 3, be reasonable. Step 4, be responsible. And step 5, be reflective. These 5 steps will help decrease the amount of issues and complaints in the health field.
The BEAR decision model provides a framework for ethical decision making. This is important when dealing with health disparities because it allows you to differentiate between right and wrongs to make a better decision.
So now we're going to bring Tabatha Cochran in, and she's going to go ahead and summarize the entire show for us today. A quick 2-minute on everything that we learned and how it all relates back to each other.
Throughout today's show, we have learned that health disparities affect our healthcare system in different ways throughout many different cases, as demonstrated in the Zubik versus Burwell Supreme Court case. Health disparities are the inequalities that occurs in the provision of healthcare and access to healthcare across the different radical, ethnic, and socioeconomic groups. The 5 goals aim at transforming healthcare, advancing the well-being of American people, advancing scientific knowledge, and increase efficiency, transparency, and accountability of HHS is a part of the action plan to reduce radical and ethnic health disparities. Health disparities affect access, costs, and qualities in our ethnical behavior. Radical and ethnic disparities in healthcare are significant factors that create many ethnical dilemmas in the healthcare sector. The ACA is the most essential part of the strategy to eliminating disparities in health outcomes, along with cultural competency to improve quality and eliminate radical disparities. Our healthcare system is improving in many different ways to remove disparities throughout our systems every day.
So right now we want to bring all our panelists back out and give them a wonderful round of applause. We thank each and every one of you for coming and contributing to this conversation. Next week, come back and join us on Healthcare in America, where we will be discussing different issues in the healthcare professions. Thank you.